'cause I like to vape. Blue, 'cause it evaporates. That's blue. And there's no smelly smoke when you blue. I like the blue.
So Leaford, I've been using my Bloog with pre-filled cartomizers, but I also see that you sell blanks, which are empty cartos, and bottled liquid. What are those for?
That's a very good question, Shirlane. Those are for refilling a used cartomizer or filling an empty cartomizer. That's an advanced technique that we do not recommend for our beginning vapors because overfilling or underfilling can damage a carto, can result in decreased performance, or can even damage the battery. However, for our advanced users, it is an economical way to save money.
So Leaford, how do I do that?
Well, there are two main methods that we recommend for filling or refilling. Those are the drip method, where basically you drip through the mouthpiece end of the cartomizer, and the cartomizer condom method, which uses one of the rubber caps that comes on the cartomizer. Let me show you first the drip method. For that, take out one of your blank cartomizers, remove it from the pre-sealed blister pack, and take the rubber condoms off of the ends. They can be a little tricky sometimes. Now remove the mouthpiece from the end. Take one of the bottles of our Bloog Liquid Fusion. Remove the child-proof safety cap. Now pick up the cartomizer. Hold it at about a 45-degree angle and just drip straight into the opening. Try to drip the drops so that they fall down along the sides and not into the center tube, and slowly rotate the cartomizer body as you drip.
So how many drops should I use?
If you are refilling a previously used cartomizer, I would say 15 to 20 drops, although it does vary depending on how empty it was before you refill. When filling an empty cartomizer for the first time, go up to 30 drops. Be careful, though, not to overfill, because that can lead to either degraded performance or it can actually damage the battery.
So how do I know if I overfill?
Besides, of course, counting drops, there are three main things to look at. First is to check the battery threads on the battery end and see if any liquid has dripped through the center hole. If you have overfilled, it will usually drip through the center. The other thing to look at is the top of the filler and the mouthpiece end. The filler should be visibly moist, slightly glistening, but it should not be visibly wet. No liquid pooled up on top. The third thing to check, and you do need to do this anyway, is to blow through the center air tube and make sure it is clear. That's correct. When you blow through, you want to look, listen, and feel. Look to see if any moisture has been expelled out. You can blow into a piece of tissue or on the back of your hand and look to see if there's any visible moisture. Also, listen. When you blow through, it should sound dry. You should not hear any aspirated moisture being expelled. And third, feel. If you blow against the back of your hand, you will feel any moisture which is expelled. If you don't hear any moisture, you don't see any moisture, you don't feel any moisture, then you have not overfilled, and it's good. Then, after filling, replace the mouthpiece. Make sure to dry off both the battery end and, just in case, the mouthpiece end. And set it aside for 5 to 10 minutes to make sure that the liquid has time to properly and fully distribute itself.
That seems simple.
It is. The next method is the cartomizer condom fill method. And in some ways, that's even simpler and quicker. For that, again, take out an empty cartomizer from the pre-sealed blister pack. Remove the condoms off of both ends. Now, pick up the cartomizer condom which does not have the plug in it. That should be the one from the mouthpiece end. Fill that about halfway if you are filling a used cartomizer, and up to between 2/3 and 3/4 of the way if you are filling an empty cartomizer. Now, remove the mouthpiece from the cartomizer and insert the mouthpiece end into the condom. Then simply force it down to the bottom, and as you do, the liquid will be forced up. Keep an eye to make sure that none of it is overflowing on the sides. Once you push it all the way down, turn the cartomizer mouthpiece side up to allow any other liquid to seep down into the filler. Tap it a few times, which will shake loose any air being displaced by the liquid and allow it to the top, thus allowing more liquid to flow down. And again, afterwards, you may replace the mouthpiece and set it aside for 5 to 10 minutes. And again, as before, you need to blow through it to make sure that the center air tube is clear. And wipe off the battery thread, the battery end threads to make sure that they are clean and dry. Okay. Replace the mouthpiece and again set it aside for 5 to 10 minutes to allow the liquid to fully distribute.
That seems simple, Leifer, but is there a learning curve to this?
Yes, there is. Yes, the methods are very simple and it seems straightforward, but there is definitely a learning curve involved. When you first begin filling or refilling, expect to lose some cartomizers. Expect some of them to suffer degraded performance, some of them to simply die. Some of them will be overfilled or underfilled no matter how you try to avoid it. So yes, there is a learning curve. But like anything else, practice makes perfect. And the more you try, the better your results will be.
Thanks, Leifer.
My pleasure, and keep on blooging.
I like the blue. Whenever I used to smoke, after each meal,
The rubber condoms off of
I
the
took